Hello everyone, I am going to present OSPI for community medicine. This is the first OSPI which is for the blood pressure measurement of a person according to the recent updated guidelines. So the questions could be like write the classification of blood pressure according to recent guidelines and demonstrate the steps of blood pressure measurement according to standard guidelines. So person will answer or the student will answer what is the target blood pressure according to classification of hypertension as per the recent guideline or the GNC 7 guidelines, where normal pre-hypertensive stage 1 and stage 2 hypertensions blood pressure of systolic blood pressure and diastolic blood pressure are there according to this table. Now the steps of the blood pressure measurement, there are few salient points. As per WHO, sitting position is preferred than supine position for recording blood pressure. A person should adopt a uniform policy, either in right hand or left arm should be used for the blood pressure measurement. Systolic blood pressure is the one at which sounds are heard first, also called as phase 1 sound. And near the diastolic pressure, the sound of become muffled, but that is phase 4, and then it disappears in phase 5. Blood pressure should be measured at least 3 times over a period of 3 to 5 minutes, and the lowest reading should be recorded as the final. And for replacement of cuff and the width of cuff, the cuff should occupy the 40% of circumference at midpoint, and the midpoint lies between the acromion and olecranon process of the bones, humerus bone and ulna bone. This is the positioning of the patient. The patient should be relaxed and arm must supported, and we should ensure that no tight clothing should be there in the arm where the cuff is to be applied, and it will not constrict the arm. The cuff must be at level of the heart, and if arm circumference exceed more than 33 cm, a large cuff must be used, and we should place stethoscope diaphragm over brachial artery. The column of the mercury must be vertical. We should inflate to occlude the pulse and deflate at the rate of 2 to 3 mm per second, and we will measure systolic as well as diastolic blood pressure. This is how the patient is sitting and the doctor can measure the blood pressure, or the student can measure the blood pressure of any subject. These are various criteria as depicted in the picture, and the phase of blood pressure, phase of the sound through which we can read out, we can listen that the systolic and diastolic blood pressure. And finally, according to various range of mid-arm circumferences, various type of cuffs are provided. So if person is child or slim adult, the cuff will be the cuff which we use for the blood pressure measurement will be small, and for average adult the medium size of cuff will be used, and for heavy muscle or obese person will use a large cuff to measure the blood pressure. There are certain source of errors in blood pressure measurement, like observer error, instrumental error and subjective error. Thank you for the